Good morning. This is Dr. Bill Wyatt. It's from the American Orthontic Society. We're going to talk a little bit about palatal separation, or trying to separate it if you can't. But in many cases, we've got people, grown people, that palates have not been separated, and that reduces the airway up here. Like your teeth are up in here, and you push this apart and bring the teeth out like this, and you increase the airway. People who breathe through their mouth, they hold the tongue in the bottom part of the arch of your mouth, and you widen your lower teeth out, and your upper teeth don't get that pressure, and so they don't spread out like they should normally do, and even your airway gets even less. Now, I'm seeing today they're making palatal separators with just one band on the 6-year molar, and putting bars on the other teeth and everything. If you've got a bar on a tooth here and you're going to try to separate it, the tooth tends to do like this. Now, it's much better to band each tooth that you've got in the separator. Sometimes I don't get the second molar back there through, so we just put the bar on it to push it apart, and maybe the roots of the 6-year molar go out. Now, we band the other teeth in there, cemented in really strong, and as we go apart, the actually cracking it apart, a lot of times your tooth will kind of tilt to the inside, but you leave it out here for several months before you take it out, and the occlusion causes it tilts. That's why the lingual cusp hits stronger than the buccal cusp, don't even touch sometimes, and that helps push the roots out and get this widened area, which gives you the airway that has been robbed from that person. So let's go through this, and we're trying to do this on a lot of people now. I remember years ago, Dr. Donald Timms from England wrote the book on palatal separation, and I went to New York to hear him speak, and I talked to him after it was through, and I just asked him how old could he separate the palate on anybody, and he told me about 17 or 18 years old, and the suture was so tight together that it wouldn't come apart. And I just, there were a lot of people there talking to him, so I didn't sit there and argue with him about it at all, but I'd already been separating people in their 30s, and a few of them in their 40s. I could go apart. But what I was doing that he wasn't doing, I put spring pressure in the front of the mouth and pressure back in the back. Like if you have an arch here and you're trying to push it apart, your separator is back in the back part, and the thing goes apart kind of like this, and you don't get the main force up here on the anterior part of the mouth. So I put brackets on the teeth and put a pack spring in there, and we were opening people's palate and separating it up into their, I had several people that got into their 40s, usually somewhere in the early 40s, you couldn't separate it that way. And I didn't get to go back and put screws in the bone structure. You could have gotten more force up there. You might be able to separate those. But here is a gentleman that I want to show you that is a big man. He weighs 312 pounds when he comes in, and he's not fat. He is just a big guy. And he's got a college degree and is a head man in some business there. read about. And I tried to separate his palate, and he was still in his 30s, and I could not separate it. I put palatal separators in, and we kept shooting pictures down through it. I'll show you some of it here. So let's get on with the guy's lecture here and show you what we came up with. Let me see, my little deal is... All right, here is a palatal separator that I put in this young man's mouth, and I shot the picture right down through the head, and this is the width of that palatal separator, and it started out, about something like that. And he did not fuss with me or anything about the pressure. It didn't seem to bother him at all. And here are the two centrals, and I took a bunch of these pictures, and after you take this at one time, and you've got a very thin bone here, the x-ray goes through it very easily, and you leave it alone for a while, and this will thicken back up. The body will mineralize that bone, and I'm sure that the palate up above, instead of having an arch to it, it probably pulled it out, something like that. But we went in with the man's upper arch fit inside the lower arch. And he was class 3, kind of like that. And we widened that out and got the lower teeth inside the upper teeth. And I mean, fitting in there like they're supposed to. In there, not totally in, but the cusp fitting up in there like that. Actually, I'll just show you the upper teeth would be something like this, and your lower teeth are supposed to come in here like this. Now, this upper tooth being out here keeps you from biting your cheek. If you have these teeth fit together, in other words, if this tooth is coming up there, you'll get your cheek in between here and you'll bite it. And I know that's a fact because my teeth, the lower jaw spread further than it should be, and I bite my cheeks. That's something I wish I would correct. But anyway, we were able to crank this separator out like that, and we corrected the crossbite, a total crossbite. The upper teeth fit inside that on this gentleman. Now I'm going to try to go through this as quick as I can, and you get the idea. Now this was when we were taking the separator out, but I had these teeth banded in here, and a real solid. It had a big bar like that coming over on this side. And you could see that if you looked at the palatal separator here, the bars going out from it that way. All right, here's other cases where we got the centrals to separate a little bit, but the suture would not separate. I think if you could put some pins in the bone structure here and put a powerful spring in here on the slipping arch wire, that you could open the palate on somebody in their 40s easier. Now, I've spread people's palates out like we're doing here into their 70s, and nearly, well, really some of them in their 80s. I've widened their palates out like that. Now let's go ahead and check the other part. Here this guy's teeth are before we started, and I left, and the people where I was working there, Dr. Worley's office, they afraid they couldn't upright these teeth, so they extracted them in here. But we will show this later. Now here is the way the guy came in. I mean, the upper arch is hitting inside the lower arch. Now, this may have been a mouth breathing problem where the tongue never went up there enough to spread the maxilla apart as he grew, and so his teeth fit inside there like that. And that's where now we're going to come back and we're going to have his upper teeth come something like this on both sides up here. Now here is the bite. You can see him biting down to that point. And there is the upper arch before we expanded it or stretched it out, and here it is after it is stretched out. And you can see it fit over. These teeth are coming over the lower teeth, not maybe as wide as we'd like it, but that's a lot of space that we've pushed these teeth, and they did not come through the bone structure. The teeth brought the bone structure with them as the pressure stayed in it, and we took some time doing this, but we corrected this kind of class 3 looking bite, and now the gentleman is hitting on both sides. And this can be done, and you can do this if you put palate separators in. But if you don't do anything else, put some pressure in here to widen it. But if you go into the bone structure up here on either side of the centrals and put some real strong spring pressure in there, then you've got pressure out here and pressure back in the back, and I think you can go into the 40s with that. And I could have probably separated this young man's palate had I done that, but I'm not practicing anymore, so I won't get to try that, but I hope somebody does try that. And here's the guy. He is a big guy. I mean, this was several years ago, and he weighed 312 pounds, I think, when we started. And he's not just a roly-poly fat guy either. He got a college degree, and he was head of some department in a business there. And so I'm going to pass this on, and I hope you get something from it. And we're going to show you how we worked up to this over a period of years. Thank you for watching now, and I'm going to sign off, and we want you to join our group and subscribe to our channel.